healthcare workers are facilitated to be able to fight against COVID-19. Going forward, fellow Kenyans, all those who break the curfew rules will be assumed to have been in contact with suspected cases and hence will be quarantined for a period of 14 days. The government will hence carry out screening of truck drivers entering and operating in Kenya going forward. This will be done at roadblocks using a combined team of health and security personnel. All healthcare workers in both public and private facilities are required to wear protective gear as part of protecting themselves as they manage the patients. We have received disturbing news that some unscrupulous persons are recycling face masks after collecting them from bins and selling them to unsuspecting Kenyans. In particular, we've noticed the recycling of the surgical masks, and we've seen different pictures in social media. And we therefore say that this is unacceptable and this is actually criminal. Together with this awareness, we're going to be rolling out guidelines on the disposal of face masks, and we shall crack the whip on anyone found endangering the lives of fellow Kenyans for selfish gains. I urge Kenyans to undertake basic due diligence on face masks that they are buying so that they do not fall victim. And also we are calling on the National Police Service, the Kenya Bureau of Standards, the National Environment Management Authority, NEMA, and other relevant government agencies to come and take action on those who are recycling masks and selling them to unsuspecting Kenyans. While still on this case, we are witnessing another unbecoming phenomenon, where people are assuming that using a face mask alone can beat this virus. We've seen cases where people are walking around, not observing social distancing and feeling that the face mask is enough. Fellow Kenyans, the face mask only confers about 50% protection. So we still require you to observe the interventions that we've put in place. Yesterday, we witnessed a situation in Baringo where elected leaders led a mass demonstration in Cabinet Town, thus endangering the lives of the locals. What we saw in Baringo must be condemned in the strongest of terms. Fellow Kenyans, remember, under the Public Health Act that has been invoked by the Ministry of Health, all gatherings, whether political or religious, remain banned. We have also noted that there are people who are presenting all manner of letters of authority to be able to move out of restricted areas. It is important for people to note that nobody has the authority to clear any person to move out of these areas other than the Ministry of Interior. We have also noticed that wines and spirits have been converted into drinking joints. These facilities are only licensed as takeaways only, and therefore we urge any Kenyans who may be visiting the wines and spirits to buy any drinks to ensure that this is a takeaway service only. And anyone found drinking at the wines and spirits shops will be arrested and the businesses will be closed down. Yesterday, fellow Kenyans, we emphasized on the importance of nutrition in boosting the immune system. We are working with the Ministry of Agriculture, Livestock, Fisheries and Cooperatives in finalizing specific guidelines that will embed nutrition security in the COVID-19 national response. Part of this will entail food preservation guidelines, kitchen garden toolkits and recipes for healthy snacks, and guidelines that help us maintain our healthy diets. I do appeal to fellow Kenyans to continue working with us and to ensure that they do maintain balanced diets that will then confer them with immunity to be able to fight against COVID-19. Now, since our last update yesterday, we've tested an additional 1,330 cases. And out of these samples, 8 have tested positive for coronavirus, bringing the total number of confirmed cases in the country to 270. 7 are Kenyans and 1 is a foreign national. And none of these cases has a history of travel. 3 emanated from our quarantine centers, and 5 were picked by our surveillance teams from various parts of the country. 4 are from Mombasa, 3 Nairobi, 1 Kajiado, and all aged between the ages of 17 and 65 years old. I'm glad to also announce that we have 7 other discharges today, taking the number of recoveries to 67. And this is encouraging, and we hope that many more will recover. Sadly, however, We have lost 2 more, thus raising the number of total deaths to 14. Yesterday, we gave a rundown of affected areas in Nairobi County, and we've noticed that almost every estate in this county does have a case. And the situation in Mombasa is not any better. Kwa sasa, Nyali inaongoza na kesi 11, ikifuata na Mvita na kesi 7, Kisauni 7, Changamwe 2. Na kule ndani Nyali, karibu kila kona kuna kesi ya corona. Bamburi 2, Beach Road 1, Mamba Village 1, Mogadishu 1, Mkomani Tamarind 1, Maweni Kongowea 1, Twiga Road 1 na Umoja 1. Kwa hivyo huu ugonjwa umeenea kila pahali Mombasa. Na ni jukumu la kila Mkenya kumshika mkono gavana wa Mombasa Ali Hassan Joho pamoja na serikali kuu kuongeza juhudi za kukabiliana na hili janga. A total of 2,661 contacts have been monitored, and out of which 2,047 have been discharged. 614 contacts are on follow-up at the moment. Fellow Kenyans, so far we've conducted 13,239 tests. Once again, I would like to remind all Kenyans, those in the villages, to remember our mantra of social distancing. Remember to wash your hands often with soap and running water. Remember to wear your face masks. Remember to observe basic hygiene, and remember to stay at home. Fellow Kenyans, at this juncture, I'd like to invite the Cabinet Secretary of Trade, Betty Maina, who will be giving further updates on our COVID response 19.
Thank you very much, Dr. Mwangangi. Good afternoon, everyone. I wanted to just give an update on our capacity to manufacture medical commodities here in Kenya, and also to send another challenge to the business community to rise up to the task. I think when we first spoke about this, that was about 3 weeks ago, we did give the undertaking that the Kenyan business community was capable of producing medical commodities. And in the last 3 weeks, we've seen a lot of innovations come on board. The Kenya Bureau of Standards has outlined the specifications and the standards for material for the production of masks. And those have been outlined, and they are available for free from the Kenya Bureau of Standards website. Those and also certification for any of manufacturers who would like to manufacture these PPEs has also been undertaken for free by the Bureau of Standards. To date, we have certified 9 government institutions for the manufacture of PPEs, and 34 private institutions have also applied and have received certification. And together, those are capable of producing 1.5 million face masks each day. And these are face masks that are made of cloth. There's also work in progress in designing and an approval of ventilators by at least 5 institutions: Toyota Kenya, Kenyatta University, Dedan Kimathi University, Numerical Machining Complex, and the Kenya Association of Manufacturers Automotive Sector. Therefore, I am pleased to announce that there is local capacity for at least PPEs and face masks. I think for PPEs, we've certified 5 companies so far, and the Ministry of Health has placed orders for that, for the delivery of PPEs. There's also local capacity for supply of hospital beds, which are available from different manufacturers, and as and when needed, we look forward to orders being placed by the Ministry of Health. Now, one of the challenges that the Minister for Health has mentioned repeatedly is the need for mass testing in the country and the absence of commodities to support mass testing. The health team has given us samples of products that are currently imported, but I think the challenge is placed before the local industry to be able to produce the materials and the sputtums for taking samples from your nose, from your throat, and for carrying. And after I've looked at it, it's actually a plastic, some plastic material. So I think the challenge is still being given to the local industry to supply these commodities so that the government is able to undertake mass testing. These samples will be available in our office, and is also available from the Ministry of Health for those in the industry who are able to produce. We've also noted other innovations by the business community, such as, contactless sanitation and hand washing facilities. We have seen innovation for spray dents that can be utilized in markets. And I think the challenge is being given to all of us to support in the rollout of these innovations. Thank you very much.
We would now like to receive questions.
My name is Purity from KBC. My question would be, because now you're saying your major concern is on the community spread and the government has been able to contain the imports. So at date 46, the US has been able to record over 700,000 cases of COVID-19, and probably on the modeling, putting into consideration the mitigation measures that have been put up by the government and also compliance by Kenyans, where are we seeing ourselves? That's one question. My question number two would go to the CS for education. Professor George Magoha, the head of state during his address this week said that you look at what works for the children. Probably any update on that?
Thank you. I'm Mark Namaka from KTN News. I'm still following up on the question that I asked yesterday and did not get a straight answer. We had a report of 2 cases of people who presented with possibly COVID-19 symptoms at KNH yesterday, and the info that we got is that those people passed on. Are these 2 part of what you have just announced today?
Maybe my question will, last week you said that the first phase of mass testing will be targeting about 12,000 kits being deployed. How many kits have so far been deployed in terms of mass testing? And in Mombasa, you've given the hotspots, if I may say. How far is the mass testing in Mombasa? How far is it? Because yesterday the Cabinet Secretary, Mutahi Kagwe, said that mass testing was ongoing and had started at the Kenya Ports Authority. Where else is being targeted in Mombasa for mass testing?
Yeah, one more.
I am Vera Okeo from Nation Media Group. Still following up on targeted mass testing, because I hear you're not doing mass testing. I would like to know the strategies that you use to decide if you're going to say Kibera. How would you decide where you're going to Kibera? And then there's a question I've been asking about non-COVID-19 centers, which are recording deaths that are related to acute respiratory infections. Like, how do you know, how do you rule out this is pneumonia or, respiratory distress? Because those numbers are not adding up to what you announced. Thank you.
Right. So let me begin by tying in Purity and Vera's question, because they're all related. Earlier on in the response to COVID, we were able to share with you one of our models. We are working with different experts, and as it stands right now, we have several models that are all based on different assumptions. When you're putting together a model beyond the epidemiological function that you would use in putting together a model, you'd be looking at the behavior of the country, how people respond to the measures that we've put in place. And this is highly important, especially when you're looking at the measure of social distancing. How are Kenyans adhering to that measure? And so what we're seeing so far, yes, indeed, the US did record that number of cases. We do know with local transmission, we are bound to be seeing increased cases within the country. And this is why the Cabinet Secretary has emphasized that we are now moving towards what we are calling increased testing, enhancing our testing capacity. I would say that the word right now to use and the phase we are in right now is that called targeted testing. And our targeted testing will follow 4 approaches. The first one is our healthcare workers, and our healthcare workers, particularly in our high-impact areas within the country, and also healthcare workers who are working in isolation, treatment, and quarantine facilities. We do firmly believe that if we can ensure that our healthcare workers are protected and are negative, then therefore the risk of transmission to the citizenry who may be seeking their care will be low. Our second target, as the Cabinet Secretary reiterated, is on Kenya Ports Authority. We've noticed that that is a cluster, and indeed cases did come up from our testing, and we'll continue running more testing in those clusters. When we look at the country, and the Cabinet Secretary yesterday did highlight a few hotspots within Nairobi, we are working to see how we can roll out a schedule that will combine both testing and screening in these areas, such as Kibera, to ensure that we are able to get all our positive cases in those areas. But there's an important element that perhaps we may not have shared with you yet, but I'll be disclosing it shortly. Vera and Purity have asked, how do we know if these cases have been with us for a while? We are undertaking what is known as serosurveillance. The country will be looking to utilize its sentinel sites. Kenya has always had 11 centers in the country where there's influenza monitoring going on in those centers. And so through partnerships with our development partners in the coming weeks, we'll be able to employ almost a surveillance system that's able to tell us for every 3rd case that's coming in with a flu and a cold, is that a COVID case or not? So we'll be able to employ this, and through risk sampling, we'll be able to tell you and to inform you, 1, if these cases have been present in the country long before we reported our first case, and 2, if actually some of the pneumonias that are presenting may actually be COVID-19 related pneumonias. And so perhaps in the coming weeks, we'll share with you the elaborate framework of how we'll conduct this serosurveillance in partnership with our public and private health facilities. And this will answer Vera's question. This will answer Purity's question as to the true state. So beyond the testing that we are doing, what else is happening in all the sentinel surveillance sites that we have in the country? So that's something that we'll be working on. With regards to, again, our phased mass testing, I think you were able to notice that the Cabinet Secretary of Health and Transport were able to receive an additional number of kits. And CS Betty Maina has called on to industrialists to help us increase capacity. It is one thing to have a kit, but there are components within a kit that you need to actually be able to do a successful run. And so in the coming weeks, we are hoping to deploy more healthcare workers, train more lab technicians, add more rapid response teams so that we can utilize the kits we have. However, it's important to note you could have a kit, but you still need the inputs to help you run a successful run. I'd like to invite our Director General to further clarify on the issue of the KNH case, and then thereafter our Cabinet Secretary of Education will be able to give more information on the question asked. DG.
Thank you. Regarding the KNH case, one of the cases reported today, a deceased person who is of Bangladeshi origin, who was tested posthumously, that is after death. And that also answers Vera's question that we not only look at the deaths at the community level, but suspected deaths at the community level, we go ahead to collect a posthumous sample to verify if the deaths are due to COVID. So one of the cases that was reported yesterday is actually reported today is actually a Bangladeshi national who passed on, and we took a posthumous sample which we analyzed for COVID and turned out positive. Thank you.
From the broader government perspective, we are following His Excellency's directive, and as a result of that, there is a 5th committee of 6 cabinet secretaries that will look at the post-corona period more holistically going forward from next week. But from the perspective of the Ministry of Education, I would like to state that we have been very methodical in what we are doing, and that by the time His Excellency was issuing his directives, we had done significant work, which at this point we would like to share with him first before we go public. And for the avoidance of doubt, I want to restate as follows, that up to this moment, nobody has thought of postponing the examinations, the national examinations, both the primary school exams and the secondary school exams. And to the best of the government's ability, the children are getting online learning, as I stated last week. I am aware that the parents are very, very apprehensive, but they should be fair to themselves, because government has not pronounced itself that the exam will be postponed. And after His Excellency the President concurs with what the Ministry of Education has methodically gone through, I hope that during the course of next week, we shall tell you the various scenarios that we have come up with, and not all of them involve a doomsday situation. And since we are very optimistic, I still refuse to be guided by the fearmongers. To the extent of the preparedness of the competency-based curriculum, I would like to state that we have slowed down on preparing for the materials that will be used for grade 5 next year. But in some of those scenarios, we have given options which would still mean that if all goes well, we shall still launch grade 5 come January or February of next year. So I, as the head of the sector, see no reason, and I would like to request the public to listen to one voice. That delegated voice by the President is my own voice. And before I speak, I consult widely the stakeholders that are relevant in the education sector. I also want to tell the parents that they should not be encouraged by anybody to congregate their children to learn together. The children must remain in their homes where they are safe, as you have heard from the horse's mouth, that this calamity is now in every estate. So stay home with your children, love them, and also teach them if you can, those who can teach them. I know that the cell phone penetration in this country is significantly high, so those with smartphones can allow their children to access information from our KICD channel, and also even those with television sets and radios. All these put together will invariably just leave a small number of children, and that number is what is giving us sleepless nights. Let's leave it there for now, and I would want the members of the Fourth Estate to continue to encourage, because I have seen